Welcome, everyone. My name is Jen Rumbalski. I'm the director of the health department in La Crosse County. We're glad to be with you today on Tuesday, May 12th. We are almost halfway through the month of May, and the weather is looking a little nicer out there, and I sure do appreciate that, and I'm sure many of you guys do as well. So I'm grateful for Mother Nature bringing us sunshine whenever possible. Today, I'm going to give you a little bit of information about our cases, as I always do. Then we're going to switch it up a little bit, and we're going to have our guest speaker talk. And then I'll come back and talk a little bit more about some other messages that I want to share and some updates. So as we usually share with regards to case counts in La Crosse County, we are currently at 35 cases. So we've had 2 new cases in the last few days here. And those cases are in a female in her 60s, and she is experiencing severe symptoms and is currently hospitalized. In addition, we have a male in his 30s who started with moderate symptoms, and those symptoms have now gone to mild. So he is feeling a little bit better, and we're grateful for that. So those are our 2 newest cases. We do have 29 individuals who have currently recovered from COVID-19 in our county. And again, one of those new individuals, new cases that we have is currently hospitalized. We continue to have 0 deaths of our county residents, which we are so thankful for. At the state of Wisconsin, we had an increase from yesterday of 193 positive cases. That brings our total up to 10,611 positive cases. In addition, we had more than 4,700 tests negative over the last day. That brings our total tests that are negative up to 112,748. For hospitalizations, we increased from yesterday by 31 individuals requiring hospitalization, totaling 1,877. And lastly, for our Wisconsinites who have passed away from COVID-19, we increased by 9 from yesterday to a total of 418. At this time, I would like to welcome our guest speaker for today. And our guest speaker is Lamaria Hawkins. And Lamaria is a college student at the University of Wisconsin-La Crosse studying public health. And as you can see, she is also in uniform because she is a member of our Wisconsin National Guard. We are so grateful to have you on, Lamaria. Thanks for being here.
Hi, Jen. Thanks for having me.
So Lamaria is a private first class in the National Guard, and as I mentioned, also a student of public health. So I'm going to ask Lamaria a few questions to give some feedback to us that I think might be helpful for those listening to hear. First of all, Lamaria, since you study public health, could you tell us a little bit about, in your own opinion, what the value of public health is?
Yes, Jen. I think the public health can be very valuable, especially in times like now. As part of public health, we strive to inform and educate the public, and especially in this scenario when people of La Crosse may not be exactly seeing the virus effects. So we want to prevent, promote, and protect the public. We do this by encouraging people to follow the behavior changes, and this includes staying home, social distancing when you go out for those essential needs, continuing that healthy lifestyle, and definitely staying home when you're sick. If we follow those behavior changes, we allow public health to change the outcomes that the virus could pose.
Wow, well said. Thank you, Lamaria. You know, one of the things that you mentioned is in regards to the virus not being able to be seen and the effects of the virus not being able to be seen. Being that you are in the National Guard, I think it would be really helpful for us to hear from you in regards to the partnership that's happening across the state between public health and the National Guard. Could you talk a little bit about that?
Yeah, so we have seen this partnership take place between public health and what the National Guard is doing. As part of the National Guard, it's our duty to always be mission prepared and ready to help the public. So we do this by setting up and utilizing our key partnership with isolation sites and testing sites that we use to help combat the virus.
Could you just generally speak, Lamaria, to what an isolation site is?
Yes, Jen. So actually, if you test positive for the coronavirus right now, we provide a safe place for you to isolate.
Yep, great. So these would be individuals who test positive, may or may not have symptoms, but get the
Right.
test and are positive for that. Thank you. What a wonderful service. Um, I also wanted to just find out from you, since you are since you are a college student as well. I think it might be helpful to hear a little bit from your perspective about, we know that upcoming here between the dates of May 15th and May 21st or so, that we anticipate a fairly large number of college students need to be moving out of their homes if their leases are up as of the end of the month. What do you know about that move out process, and what guidelines or suggestions from a public health standpoint might you have?
Yes. So as a UWL student, I definitely can attest to the influx in population that we see during that time period. We noticed that a lot of gas stations, local stores, they definitely get more populated during that time because of the move in or move out. A lot of people have family members coming from across the state to help with that. So to opt for a safe move out time and prevent the cases from going up, I think if we just follow those behavior guidelines, we would prevent this. You can do this in different ways by utilizing face mask and always washing your hands before you go anywhere. I even recommend having a designated runner for when you do have to use those essential tasks.
That's a really good idea, Mar. Could you talk a little bit about, from the face mask perspective and the physical distancing aspect? Just share a little bit about, again, suggestions for college students and their families to be thinking about when they're doing this move out.
Yes. So as I said, follow those behavior changes. I also know that maybe a lot of college students might not be watching on this platform, but avoid social gathering at all costs. A lot of viruses can be spread that way in those close contact times. So you want to avoid that.
Thank you. I think that comes back again to the virus not, it's not something that we can see, and
Right.
it may not feel real if there are individuals that don't haven't had experienced symptoms or changes in their lives relating to the virus. So appreciate that. Are there any other messages you would want to share with us?
Yes, Jen. I think in your last briefing, you said it was 76.9% of the positive viruses that we've seen in La Crosse County have been under the age of 60. So I think it's important to note that the virus doesn't discriminate, so neither should we. And in that, if we all unify together and support each other and participate in this pandemic, it will definitely end sooner than we think. I think also, to end on a positive note, take this time to contact your loved ones and really do that self-care portion, because a lot of people on the front lines aren't able to go to their families. So definitely don't take that for granted.
Yeah, I think that's an important way to sort of the distinction between social distancing and physical distancing, that, we need to maintain that 6 foot space, but we still can be social and need to be. So yeah, thank you. And I think it's important to think about all of our loved ones, because we're not just trying to protect ourselves, but also our loved ones as well. Yeah.
Yeah.
Thanks,
Thank you.
Lamaria. So Lamaria will be available for questions when we are done with the updates. So at this point, we will move to a couple of updates that I'd like to share. And primarily the update that I want to talk about is in regards to the college move out. We are creating some guidance that we already have shared information, for example, on our Facebook page. And we are looking at a couple of key points that we want, particularly knowing that college students don't always look at Facebook, that we want to really get to those that might be asked to assist with the move out processes. So we do want to recognize that the moving process does bring in additional people to our community, and these individuals may come from other areas of the state. We hope that they are not coming from areas where we would consider to be hotspots for the virus. So we predominantly would like to recommend that, we are careful about travel first and foremost. Secondly, I think limiting the number of helpers that might be needed, only asking for those that you really need, and if possible, using roommates, for example. They are already considered household contacts and are very appropriate for you to be connecting with to assist with the move out process. Communicating with roommates and scheduling a time so that everyone isn't doing the moving at the same time. That will minimize the number of people that are together and congregating at any one time or location. So within multi-unit apartments, communicating with the landlord as well to see if there might be a scheduled move-in or out time. If you're getting moving help from family and friends from outside of the community, we ask you to plan ahead. Bring all the items that you might need, boxes, cleaning supplies, all of that sort of thing. Bring that with you so that you can limit the amount of shopping you may need to do when you're here in La Crosse County doing the move out. And if you're not moving, I think the message would be to just remember this is a time where individuals need to get their items out of their current residences. And because of coronavirus, it has really been a challenge for those that need to move out, that they do need to get their items. And so I think what we can do is, if we're not part of the move out process, remember that this is a high traffic time period, and think about avoiding areas of high numbers of people. So just as we would say about other peak times of shopping, thinking about making sure that you are getting what you need ahead of this time period so you don't have to do a lot of grocery shopping or other sort of essential travel. Thinking about what you might need and trying to, for this time period, address not needing to go to areas like student neighborhoods, grocery stores, restaurants, and hardware stores, knowing that those are going to be highly populated most likely because of the move out. And thinking about high risk individuals or people at higher risk for complications, really taking essential steps to avoid going out. Because those individuals, if they do get exposed and come down with COVID-19, would be more likely to have severe disease. And we definitely don't want to see anyone requiring hospitalization or worse from exposure to coronavirus. A totally separate update that I wanted to share is that we have talked last Friday in the media briefing about the potential to apply to the National Guard for a testing site. We have submitted that application. We did so yesterday. We heard immediately from the Guard and had a call with them this morning, and we're talking about logistics. We are waiting on the final approval for the site. So more details will be available as soon as we get that final approval. We anticipate that that will come sometime tomorrow, and we'll be able to get the final details out to all of you, letting you know what the details are. And it will be a site we hope will be later next week. We don't have the date finalized yet until we get the approval from the National Guard, but we anticipate it being later next week. And we believe that it will be specific for the public to those that have symptoms. So again, more details to come on that as soon as we get final approval from the National Guard. Beyond that, I just want to again acknowledge that we continue to wait for the Supreme Court's decision in regards to the Safer at Home order. And I think that, the main message that I have for you at this time about that whole process is that we don't know what the Supreme Court's decision will be. However, it doesn't really matter what gets decided. I think predominantly we have control over certain things, and what those are the behaviors that we've talked about in the past. And so we know what we need to do to minimize our own exposure to COVID-19 and also to minimize the potential that we might expose others if we are an asymptomatic carrier of the virus, which means we don't have symptoms, but we could spread the virus. So we know that those actions are minimizing physical contact with others, particularly close physical contact within 6 feet, minimizing travel. I want to just reiterate that if we are traveling to areas outside of our county, particularly areas in our state or outside of our state that are hotspots, clearly we're not able to do that right now under the Safer at Home order. But if for some reason that order gets overturned, travel will be a significant risk to our residents and residents of counties surrounding us we don't have right now a lot of positive cases. We are ramping up testing. We have a site coming later next week, we hope. And we do want to do more testing, so that will help us know more information about how many people might be symptomatic and not getting tested yet, how many people have this disease and we didn't know it. That is the point of doing more testing. So we're working on that, but until we have more information, it really comes back to making sure we're minimizing travel, minimizing the close physical contact with those outside of our household. And then, of course, all of the other behaviors that we talk about routinely, covering our cough, staying home if we're sick, washing our hands frequently with soap and warm water. All of those things will make a big impact to keep us safe and to minimize others from getting sick and potentially having severe symptoms or worse. So I just wanted to remind you that those really are the points to keep in mind no matter what happens with the Safer at Home order and the Supreme Court's decision. So at this point, those are the updates that I have to share, and we will take questions from our media partners.
Hey, Jen, Declan Levy, WXOW. So do you expect cases in La Crosse County to climb quickly after the site it becomes up, as we saw in Eau Claire?
Yeah, that is a good question. So in terms of cases and whether or not we expect them to climb, I think that at this point, we don't know how many individuals in our community might have symptoms and for whatever reason have not been tested. There are a number of reasons why individuals might not get tested, to include access or even fear about the testing process. So I think it will help us understand how many people have symptoms and hopefully they will come to the site to get tested. I do anticipate we will get more cases. I don't know how many, nor do I know, that will be a fast climb, but I do anticipate more positive cases from the site. And I think, it will just be one step in many steps to help us get to where we need to be with testing.
Hi, Jen. Justin with WKBT. I know we've brought this up pretty much, it seems as though every other La Crosse County briefing, but would you mind just kind of reiterating again the importance behind the social distancing and how much of an impact it really does have on keeping our numbers as low as they have been?
Yeah, so again, there are actually some really good short video clips out there. We've talked about contact tracing, and what that really tells us is how quickly this virus can spread among people. So it doesn't matter who you are, what age grouping you're in, what your level of immune system compromise might be. It really comes down to your physical contact, your close physical contact with those outside of your household. So anytime that you are outside of your household with other individuals, even if it's for what we call essential travel, or essential shopping for groceries, things like that. And we know that there are individuals out there that engage in practices and social gatherings that we don't recommend. I think it comes down to, again, recognizing how the virus spreads. And this is a virus that spreads through droplets. So by talking, coughing, sneezing, singing, yelling, all of those, the droplets escape your mouth and are able to be in the air for someone within a 6-foot radius in general to be able to pick up. And once those virus droplets get into another individual, they begin to replicate, and you have disease in the other individual. Now, that disease may not result in symptoms, which is, I think, a concern. We have a great concern with this virus that we don't know how many people may have the virus and be able to spread it, but don't know they have it. And so again, it comes down to recognizing that not only might we expose ourselves, but we might unintentionally expose others. anytime that we are in close physical contact with those outside of our household. So in particular, I think about the close physical contact within 6 feet and also the travel, because if we are traveling, while we have some risk in our own county and communities, there is much greater risk in areas that we would deem viral hotspots, which occur even in our own state. And again, we have had, we know that there are individuals who are making choices about being in close contact, especially for important life events like, celebrating holidays and thinking about the upcoming Memorial Day holiday. I worry that our fatigue with these behaviors will encourage some to lessen their focus on the ways that really decrease risk of this virus for many. So I just can't focus enough on, we know what to do and we need to continue doing what we know what to do.
Declan Levy, News 19. As we inch closer to the end of the governor's stay-at-home order, May 26th, will it be as simple as we can just go back to our normal lives, or what will be the process to quote-unquote normalcy once May 26th comes around?
Yeah, that's a great question. So thinking about May 26th is the current date that the Safer at Home order expires. We know that the Badger Bounce Back Plan, which is really a plan that gives us some framework for how we will transition from Safer at Home to phase 1, and then after that, phase 2. We don't anticipate that, we'll move to phase 2 quickly. Phase 2 isn't even normal life. And so recognizing that it is not going to be nowhere in our near future will we have, you can go out and do whatever you want and there aren't any behavior asks. That just isn't part of our reality right now. And it's because of the virus. This virus does spread easily and it can cause significant health impact, to include many Wisconsinites not surviving this virus. So we take it very seriously, and it's hard because we don't see the virus. We can't see it. We don't know where it is. And so it is really all about those risks and minimizing those risks through the behaviors that we make and do. So in terms of next steps, we look at the data frequently, and right now, many aspects, to include hospital capacity for surge if there are large numbers of people who are sick, we're in a pretty good place with that. We're in a fairly good place with public health capacity to do disease investigation and contact tracing, because of course we haven't had a huge surge in cases. We'll be able to really test that process after the testing event that we have from the National Guard, because we anticipate that there will be lots of phone calls to make, whether that's negative or positive test results. And then, of course, the disease investigation and contact tracing process for those that might be testing positive. But I think in the epidemiology side, or what the virus is really doing, that's where the questions lie. And it really does come back to testing to understand what the virus is doing, how many people who have symptoms actually have the virus, that those symptoms can be attributed to the virus or not, how many people who don't have symptoms and particularly work in high-risk settings, like healthcare, long-term care, frontline workers, first responders and police and fire, how many of those that don't have symptoms have the virus. Those are all really important questions for us to be answering through testing. So that's really where our focus is right now, is to try to increase testing quickly so that we can identify what we really have in our county and communities with regards to the virus and how the virus is acting.
Justin with WKBT again. Today we had spoken with a gentleman from Gunderson on genome testing and kind of mapping out where this virus has gone. I just want to get, I guess, the county's perspective on that information and kind of how they're using it to their benefit and how useful it is.
Yeah, so this gentleman from Gunderson has been sharing this information with us at the health department, and I actually took some time and looked through his data yesterday. It's very intriguing to see the different, as this virus replicates, it changes a little bit each time it replicates, and so you can tell where there are different groupings of the virus. And let me just clarify, that doesn't mean that we have, these are called substrains. So it doesn't mean that the virus has mutated, though we might be able to tell that if it does that. It just means that there are variations in the way that the virus replicated, and you can tell that. So as the virus moves and replicates, you can see connections between cases, really based upon the information that we can get from the genome sequencing of the virus itself. And so one of the things that I've found very interesting about that information is to come back to our contact tracing and identify if we caught the connections that the genome sequencing caught in cases. Did we catch that in the contact tracing process? And I'm really happy to say that so far we have caught all of them. And again, that goes back to the value of the contact tracing process and how important it is to be good at that process, because it helps us see where the connections are. And I think it gets tricky if you have individuals that don't have symptoms and you can't identify where someone got the virus from, particularly if the individual with a positive case, for example, is not going out and connecting with people routinely. Then it makes you look at household contacts first, and if those contacts are not symptomatic, those are all very interesting pieces that we follow up on very consistently and comprehensively, because it helps us make sure that we are reducing risk to our population by assuring we catch everyone who might have been exposed, and we provide guidance to them and help them properly quarantine themselves if they don't have symptoms, or isolate themselves if they do have symptoms.
Hey Jen, just curious if the health department had any thoughts on Evers allowing small businesses to open with no more than 5 customers at a time, and if you had any safety tips or advice for local stores as they begin that reopening process.
Yeah, thank you, Haley. I think, as I've said all along, the most important thing here is to be balancing between the needs in our community. And we do have needs in our community around, businesses and people being able to work. So, while ideally we would be able to say we have enough testing to know exactly what the virus is doing before we make these sort of adjustments, I just don't think that that is always realistic. So I think this turn the dial approach has value to allow for certain parts of our community to have livelihood in the midst of our balancing the risk to lives. And so, so far, I think we're doing well with that. And my recommendations and guidance would be all of the same things I've already talked about apply to businesses. We have had a really good business toolkit out there for several weeks. In addition, the Wisconsin Economic Development Corporation has now put out guidance that is specific to various sectors and types of businesses. So I think that both of those are very good resources to be following. In general, it really is about both protecting your workforce as a business and protecting your customers, so that you are assuring that the way the virus spreads cannot spread easily within your business. And so that is coming back to the 6-foot guidance and the close physical contact and minimizing that happening, as well as the fabric face coverings we highly recommend. And just remember that those face coverings, the person who's wearing the covering is protecting others around them. That is not a face covering that protects them. It protects those around them in case they are an asymptomatic carrier of the virus. So the more people that we have out there wearing the face coverings, the less the virus can transmit if we have a number of individuals in our community that don't have symptoms and might be able to spread it.
Declan Levy, News 19. What do people in our community need to know about these National Guard sites? Assuming that it gets approved for our county, will the site be open for more than one day? And how many people can the community site test per day?
Yep, those are great questions, Declan. So in terms of the community testing sites that the National Guard supports, how this works is you submit an application and you identify on the application the asks that you have. So how many test kits do you want them to bring? Where would you like to have the site located? What date would you like to have? They give you the option for 8-hour time periods. So what we know is that we've submitted that and we're waiting for their final approval on the site, all of the details pertaining to that site. So I think that, we will be able to announce many more details about this tomorrow. What I can say right now is we did submit the application. They have reviewed the application. Initial negotiations have happened. We anticipate that this site will be approved and we will have it late next week. And we know that we will be able to test anyone who has symptoms. And again, more details will be coming. But I think it is an important part of our strategy to increase testing along with our healthcare partners who have been helping us all along, increasing testing so that we can understand more about this virus, especially in light of the timeline that we seem to be on with the safer at home order and the unknowns about our ability to move from safer at home to phase 1 and when that may happen. A lot of that hinges back to testing and understanding what the virus is doing in our community. So this will be just one of, I think, more than one application that we put in for National Guard testing sites. And we also know that the state has a strong push, though again, not lots of details yet, but they're very interested in making sure that long-term care facilities can test residents and workers as well. So, this is one step in, we hope, a series of steps to try to increase testing and learn more about what this virus is doing in our community.
Justin with WKBT. This one will be directed more so at Lamaria, if she's still there. So earlier you talked about kind of what an isolation zone is and kind of all the great work going on with that. But what is offered in these isolation zones for people being treated or being isolated there? And kind of what are you all doing to keep yourselves safe in terms of trying not to get this virus?
Yes, Justin. So we actually do take very good PPE precautions in donning and doffing our gear. And then we as well provide a safe place to isolate for those who have tested positive for COVID-19 and those showing symptoms.
So I'll just add, and Lamaria, you can correct me. I think that your personal protective equipment includes probably gowns, face masks, perhaps face coverings as well, gloves, all of that sort of thing. And so this donning and doffing process that you speak to is an important way that medical personnel typically assure that they don't contaminate themselves if that personal protective equipment or PPE gets contaminated from an individual who they're treating or serving.
That is correct, Jen.
Jen, this is Caitlin with Wisdom News. I don't want to put you in the position of having to speak for our medical partners in the community, but we've been seeing a lot of reaction on Facebook saying, why are we bringing in the National Guard for testing sites when we have hospitals furloughing workers?
Yeah, thanks, Caitlin, for that question. So what I can say is remember that individuals have different work responsibilities. So these health systems are large systems. They have to make decisions that we aren't a part of in order to make sure that their systems are operating to the best capacity they can be. Testing is just one piece of that. And we know that the testing has been ramping up at both our healthcare facilities in La Crosse County. and they are doing great work our healthcare partners are doing great work to increase testing. And we've had conversations with them about the testing needs. And because the needs are higher, and because of the time frame that we're under to try to learn more about this virus, we felt like we needed to bring in the National Guard testing site because they have a service that we think is important and valuable to our community, to pair with and be in addition to the testing that our healthcare partners are really working hard to continue to increase. So it is really a partnership and not an either or. And we work together to get to the overall goal and objectives. And in this particular situation, we have a significant need to understand what this virus is doing in La Crosse County. And we believe that the National Guard site can support what we already have and enhance it in order to understand more about the virus in our community.
Declan Levy, News 19. This one's for Lamaria, if possible. There we go. First of all, thank you for your service, Lamaria. But so you're seeing this at the first hand. So what have you seen? Are people emotional, grateful for the testing? What exactly are you seeing?
I'm actually not at a testing site, so I can't attest to that. But I know as a family member of someone who has been affected by COVID-19, I think having those services, I would have been grateful for that. I hope that does the trick. If you have further questions on that, I can direct you towards our public affairs officer and he will help you with that.
So as Lamaria mentions, I think that there are a number of Guard units that have been operationalized across the state, and they have varying job duties. And I was just researching on the Guard's website. So the Guard is involved in a number of testing sites across the state. They're also involved in supporting and manning, like Lamaria is, isolation sites where they care for individuals who have COVID-19 but don't require that higher level of care in a hospital. And there are still others that are supporting other functions in partnership with the state health department around distribution of PPE and other types of activities. So I think the National Guard has been a huge force in terms of supporting the public health objectives and goals across the state. So it's a really wonderful partnership.
For more information on that, you can go to the National Guard website. I know they do have quite a bit of detail on there as well.
Justin with WKBT. Jen, this one will be directed back at you. Earlier this month or early last month or late last month, I should say, you released a lot of information on, I guess, a lot of the first cases that happened in La Crosse area. And a significant number of them had kind of underlying health issues. But these two new cases, did they also have underlying health issues?
Yeah, that is a very good question. I can tell you that the one case has significant underlying health issues. The other one, I'm not aware if they do or not. So definitely one of them does have underlying health conditions.
Jen, I know we talked about this a few weeks ago, but we get the question again as it's getting warmer. Rummage sales, garage sales, do you think that we're still going to be able to have those?
I think that rummage sales and garage sales have the potential to, it comes back to how well they're run. But it also does increase travel and individuals that are stopping by to see things, touching things, potentially being in close contact with others. And it becomes difficult for the person that might be running a garage sale or a rummage sale to make sure that they are, not allowing the close physical contact to occur. And I think because lots of times these happen inside garages or in driveways, I just think it's a significant challenge to do it well. And that's what we typically think about with regards to, being able to operationalize something that may have risks. And again, it is all about minimizing physical contact, and it is all about decreasing travel, particularly to hotspots. So thankfully, we don't have major hotspots right around us, in Wisconsin at least, but there are hotspots in certain areas of locations, in our community partners. So I think that there are inherent risks in having those types of events, and if they are not essential, my recommendation would be that we don't have them.
Justin with WKBT again. I'm glad you kind of brought up that risk of travel as well as the hotspots, and I kind of wanted to just hit on what we talked about earlier in terms of moving out and kind of moving into these apartments. What if you're in a position for some of these kids or students here in the area that unfortunately the only family coming to help, or the only help they do have, is from family from these hot zones, either moving to or from, and kind of having to come back to the area. I guess any kind of recommendations? I know you brought up the cleaning, but if this goes on throughout the summer and they come back in the fall from one of these hot zones, I guess what are they to do?
Yeah. I think, first of all, you have to know that you're coming from a hot zone. You need to be aware of the cases and severity of cases in the county in which you live, whether that's in Wisconsin or not. So we know that there are lots of folks that may not be from Wisconsin. So that's the first thing, is the awareness of what your risk level is for having, potentially having COVID-19. Then I think it's an internal check of symptoms. Do you have anything, to include, we just hear so many times that individuals, that they thought it was just allergies, they thought it was congestion. It didn't seem like anything that was a big deal. But again, any symptoms at all on that list, any symptoms, no matter how mild, can be an indication that you have COVID-19. And we also know that you may not have any symptoms. So my first and most important recommendation in that situation would be, beyond knowing what the risk level is in the area you actually live, it would be wearing a fabric face covering, because that is, and the physical distancing, to the best of your ability, keeping 6 feet from anyone outside of your household. And wearing the face covering will greatly reduce the potential that, as you are speaking or perhaps coughing, first of all, we'd hope that if you're sick, you are not leaving your house. But if you are speaking and you have the virus and could be shedding it, if you have a face covering on, the ability for that virus to get past that face covering as a barrier is greatly reduced. And so, I think it's awareness, and it's wearing a face covering, and it's abiding by the 6-foot distancing rule.
Do we have any other questions for Jen or Lamaria today? I don't think so.
Okay, well, thank you again. I just appreciate being with you all and helping to provide information. As always, let us know if you have questions. We want to be present and available for you through social media, through our website materials, our COVID-19 email address, and our phone line. And I want to just thank and give my gratitude to Lamaria Hawkins for being on today. I think as a college student, it's really important to see that we have responsible, college students out there who are doing great work. There are many of them, not just Lamaria, but thank you, Lamaria, and also thank you so much for your service. We appreciate you, and we will see you back here on Friday. Thank you, guys.